Back with Dr. Aznavour. Dr. Aznavour, periodontal disease, gingivitis, gum disease, all those names, are they all different things? Is it all the same? What are the stages? And what is the real bad thing about having a gum disease, besides of, I guess, having a bad smell?
The biggest issue with gum disease is it's the most common form of tooth loss. That's the biggest issue. There's a few stages of gum disease. Usually there's gingivitis, and then we go into what's called periodontitis. Now, what's the difference between gingivitis and periodontitis? The difference between gingivitis is that gingivitis is the beginning stage. It's the inflammation of the gum, of the gingiva, and that's why it's called gingivitis. Periodontitis is the progression of gingivitis when you start losing bone that supports your teeth, okay? And there's a few stages of periodontitis. There's the mild, there's a moderate, and there's a severe. And each one is associated with the amount of bone that is lost. You know, it starts with a few millimeters, and then it goes up to 6 millimeters. And that's what causes the most common form of tooth loss. When you lose the surrounding bone of the tooth becomes loose and it falls out. Also, there's many factors that can contribute to gingivitis or periodontitis, and that can be diabetes, heart conditions, and in turn, that can also, gingivitis or periodontitis can in turn cause heart conditions as well, causing high blood pressure or platelet aggregation, which is the clotting of the blood.
Well, so it looks to me, I mean, after all, you dentists are very good these days in replacing teeth, implant, dentures, crowns and bridges, and yes, it costs some money. But obviously we're not living anymore in a time like, I think, George Washington, who supposedly had a wooden tooth in it. That must have been awful, if it's true. But the point is, from what you just said, I mean, heart disease and stroke, simply because obviously when you have an infection, an infection, that yellow, ugly, reddish pus which travels, if it's in your mouth, it's the gateway of the blood vessels, and it can travel everywhere, right? Is that what you're saying?
That is correct.
And so if it travels everywhere, I mean, you don't want to have this yellow, ugly, yellow, reddish pus traveling all over the place. So it looks to me an infection is a much more serious thing than actually the tooth loss, because after all, if you have a little bit of money, you can replace that. But how are you going to replace your kidney, your liver, your heart, and things? I have heard that a Japanese researcher in a Japanese university researched that, for instance, people with the HIV virus are much, much more susceptible to get the AIDS, turning it into AIDS, if they have gum disease, simply because the immune system is so low. Is there any truth to that?
That is very true. That is true, because that is why, for example, some HIV patients, because their immune system is so low, we have to pre-medicate them with antibiotics before we do any type of cleaning sometimes, because the mouth is full of bacteria, and although you do have a healthy immune system in most of the population, if that bacteria gets into your bloodstream, it's full of bacteria. It's gonna, with a weak immune system, it's gonna attack, either it can attack the heart, it can attack joints, it can cause all kinds of serious infections. And that is why with some HIV patients, we have a consultation with their doctor to see how their immune system is, and according to their recommendation, we will sometimes pre-medicate them so that that bacteria in the mouth will not enter the bloodstream, or if it does, at least the antibiotics are there to help them combat that bacteria.
Right, but the fact is that they probably already have a lowered immune system because of the gum disease. That's what this research...
That is also true.
Yeah. And that is, to me, super, super alarming. And for instance, in California, I think there's only one case. There was a baby born, stillborn, meaning dead, simply because they found gum disease infection in the placenta. Now, it's only one case, but it just simply shows how, if something like that can happen, what about the everyday flu? The next swine flu, bird flu, or just the next flu in the next flu season? If you have infection in your mouth, which with no doubt is the gateway of the blood vessels, because if you take salt or anything into your mouth, it goes right into your bloodstream. So why not the infection? Isn't that, to me, this is devastating. To me, this is like the major reason why you don't want to have any infection in your mouth. Never mind the tooth loss, in my opinion. I don't know. I'm not a dentist.
Well, that's very true. You have to make sure your hygiene is very good. And one of the things you pointed out, which is very important about the stillborn baby, is that, yes, parents or people who are pregnant that get regular dental care, it shows that people who don't have periodontal disease, their babies are born with a higher birth weight compared to patients who have periodontal disease and are pregnant. They don't take care of their gums. The babies are born underweight. So it affects everything. It affects your whole body. So in terms of bird flu and the swine flu, that I cannot answer because we need more research in that. But it has been shown in the various journals that yes, periodontal disease can cause low-term birth weight in babies. So that's a very, very good point.
Well, I understand that there's no research about the flus and stuff like that, but the way I look at it is if there is an infection going on in the body, the soldiers, the immune system has to go there, fight the infection, and it's almost like with fighting many wars on many fronts. If they have to come here and fight your infections in the mouth or wherever the infection went, there must be less soldiers in your body fighting the next, any type of illness, any type of things you could possibly get. It's just a common sense from me. That's, of course, nothing clinically.
Oh no, there is no doubt. There is no doubt about that because your body has so much white blood cells, let's say, to fight infections, And if everything is in one area and all the blood pressure is going to that one area and it's depriving other areas of necessity nutrients, yes, that is very true.
Well, doctor, I gotta end this interview now. I gotta go to my dentist and clean my teeth. Bye-bye.
All right.